My name is Professor Zoe Winters, and I've been an honorary professor of breast surgery for the last 8 years at UCL. I'd like to talk a little bit about one-stop clinics and why, because that is the initial interface. It's the first time I get to meet you, and clients come to me with a particular concern. I'm in central London, I'm in Harley Street, and potentially will be at Battersea Power Station. You may perceive a lump. That's obviously very concerning. You could have breast pain, and our general assessment of pain is that this is an arbiter of disease, and so you may be extremely concerned. You could have a nipple discharge or want to understand a little bit more how best to screen your breast, how often you should have a mammogram and or an ultrasound. You might also present because of your family history, which appears very high risk, or simply because you want to know what your risk is and how we take forward a sensible MOT for breast health in you. And so how do we approach this? Or you could be a gentleman with a painful lump. The other thing is that is very common in our practice are second opinions, where you've already been diagnosed with a cancer, but you don't really understand what's going on. And we take second opinions from all over the country and also internationally, and we're happy to do video calls as well as face-to-face. And I'm underpinned by an excellent administrative team that are very familiar with this. And so you work with us to get all your reports, and we gain independent external reviews and therefore try to find any sort of chinks or any aspect that we can to help you and to make it a seamless experience. So most of these things are going to be benign. 95% of these problems will not turn out to be a cancer. The consultation is 30 minutes up front, and so we cover many topics. I explain normal anatomy. It's important for women to understand what the breast composition is, because things start to make sense when we go through examination. The breast is a modified sweat gland. It's functional. So fluctuating hormonal influences, cyclical influences with the menses. What is a true lump? I take steps to show you how to examine how we define a lump compared to normal breast tissue. And also following the consultation, we cite the latest evidence, and we have every report that is shared with you through our digital portal. So we also talk holistically about your age, your ethnicity, your family history, women's health, reproductive history. Have you taken oral contraceptive pills or HRT? And we contextualize the HRT discussions of risk. Whether you have higher body mass index may require referral to weight loss specialists. Diabetes, very important to control as a risk factor for breast cancer. Also endocrinology, you could have high thyroid hormone levels or high prolactin producing the nipple discharge. And we also discuss bone density. It's incredibly important for women to be aware that they shouldn't be afraid of a mammogram. The radiation exposure is now extremely minimal. This may be akin to a long-haul flight or 3 months of normal living. So it's very important to quietly and calmly ensure that women understand all aspects of breast screening, because the aim is prevention or detection of extremely early cancer, either stage 0 as microscopic or extremely small, because that could engender a 10 to 20 year advantage in survival. Women may also come to us because they've had an implant augmentation. We work with leading plastic surgeons regarding complex cosmetic revision, and we discuss factors around implant capsules. We obviously evaluate implant integrity through screening, and we provide evidence on the rare forms of anaplastic lymphoma in implants, which tend to be historic in nature.